Hi, Mary Lee. My name is Jen Austin. I am a nurse in Cedar Rapids, and I've been hooked up with the Refresh and Retreat Stroke Camp for a few years now, and I'll get to that. But I'm going to share a little bit of my nursing background and what brought me to this point. As I said, I'm a nurse in Cedar Rapids, and my background is in critical care in ICU. And I did about 6 years of ICU nursing at a couple different hospitals. And that is really where I got my first exposure to stroke patients. We learn about them in nursing school, but on the med-surg unit that I had worked on for a few months, I never had a patient who exhibited stroke signs and symptoms, never took care of a stroke patient. So then when I started in the ICU, yes, I'm in Cedar Rapids, Iowa, sorry. When I started in the ICU, then I got that exposure to stroke patients. And I started out at Mercy Cedar Rapids in Iowa in their ICU, and we took care of patients that would get TPA or stroke patients that weren't TPA eligible. And I did that for 3 years before I then went to the University of Iowa to their neurosurgical ICU. And there I saw every type of stroke imaginable, every type of situation for our patients imaginable. And that is where I got the majority of my stroke experience. And as an ICU nurse, I thought, okay, the work I'm doing here is the important work. You know, I'm helping keep these patients alive. This is like the meat of this care for this stroke patient. Little did I know that I was not doing the important work in the ICU, but that was just the beginning and the bare bones of the important work. So after working at the university for a couple years, I needed a change in my work schedule, and one of my friends from Mercy, where I had worked at previously, reached out to me and told me they had a position for a stroke coordinator. I had no clue what that entailed, but I was like, I know how to take care of stroke patients, so this should be fine. So I took that job in 2017 and learned about all the ins and outs and the whys of stroke care, and just got a lot of experience of the behind the scenes and the evidence-based practice, and explaining why we do things the way we do at the bedside. I started that in March of 2017, and within a couple weeks I was getting phone calls from Lauren and Mary Lee about stroke camp, which had not been explained to me during my short little orientation, and I had no clue what I was getting myself into. But I was like, okay, I'll show up first weekend of May, get some volunteers, and see what I've got in store for me. And I was very nervous. I had no clue what to expect. I had met Mary Lee, I think, once before I went, had a few phone conversations, but I really didn't know what my role was going to be at the camp or what to expect from camp in general. I left that weekend so excited about my job. Like, I had been excited about it before, but 2 months in, you know, you're still learning a lot. It gets to be a little stressful because you're overwhelmed with all of the things you're learning. But after stroke camp, I couldn't have been more excited to be working for the stroke population, and everything that I learned that weekend I took with me and have carried it through my job, especially on the hard days, the days that I'm frustrated, the days that things don't seem to be going well, the days that I'm sick of the data and the numbers. I just remember all of that pays off for the people who experience stroke camp, or the stroke patients who haven't yet been to a stroke camp but may one day. So to talk a little bit more about stroke camp and just why it inspired me so much, being an ICU nurse, like I said, have always taken care of a patient for, you know, a few days, maybe a couple weeks, and send them on their way. Never really see how they're doing afterwards. A few patients would come back so we could see them, but there's not a lot of follow through because they usually don't remember their time in the ICU, don't remember their nurses, so we're not ones they come to visit very often. But stroke camp allowed me to see the after the hospitalization of these patients and stroke survivors and their caregivers. And that follow through of seeing where they had been and where they are now was really inspiring to see everything they've worked through. And I'm just a people person, and so I like the connections with the patients and with the people. And so to see their relationships and how they've made it through something as challenging as a stroke was just really, really cool for me to see. I remember after the first weekend, I walked away and I was like, I seriously love every single person that I met this weekend. Like, I love them so much. I didn't even know it was possible to love people that I had just met on Friday afternoon and to walk away Sunday afternoon just having so much love in my heart for them. But the vulnerability that people show during stroke camp and the just the openness and the fun, the lighthearted side of people that you see, it just really allowed me to see my patients in a different way. I also learned that stroke camp and after their hospital stay is where the meat of the recovery and the work takes place. Stroke doesn't just end at discharge from the hospital, but it continues, and the work that these families and caregivers and stroke survivors put in day after day, that also was incredibly inspiring to me. It doesn't matter if they have a hard day, they get up the next day and continue again. And for me, being younger than a majority of them, it just kind of put me in my place a little bit. How can I sit here and complain and whine about my hard days when I see people who are going through things way harder than anything I've ever gone through continue to push through? And I know I've said the word inspiring probably about 20 times, but it just was so incredibly inspiring. I was awestruck by how amazing they are, and to see the couples and hear them talk about how their relationship had changed and how they had worked through it was also just really cool. One of my favorite parts was the first weekend, the first stroke camp I've went to, because I've been to about 4 now. I chose to go to the caregivers breakout session because I've dealt with patients and stroke survivors, and I just kind of wanted to hear what the caregivers' viewpoint of things were, because you don't in the nursing field get to hear from that side a lot. And so I was kind of taken back at how much everything they said resonated with me. My husband, who by the way volunteered me to do this, thank you, Jeffrey. My husband is in the military, and so having gone through a deployment and he's had a TBI, there were things that I could hear these stroke survivors or stroke caregivers talking about that I had never realized were changes I'd gone through in my marriage and in my relationship and with my spouse. I'd seen some personality changes after his deployment and TBI, and just hearing how they had worked through things, it was really interesting to be like, oh, I've kind of done some of those things, or oh, I should probably look at things differently and work through them differently than I have been. And so I learned so much from these caregivers, even though I'm not married to anybody that has had a stroke, but just in my everyday marriage, I learned so much from these men and women because they were willing to share and be open. I also really love how stroke camp is so inclusive to everybody, and that goes from the survivors and the caregivers to the volunteers. There is something at stroke camp for everybody. You can find some aspect of it that you're going to enjoy. I'm a people person, so I loved it all from the get-go. My husband is not a people person, and so after I came home and told him all about the first weekend, the following year he was like, I want to go with you. And I was like, ooh, not because I doubted stroke camp, but I just wasn't sure how he would do, because it's a lot of people all weekend. It's a lot of interacting. It's a lot of therapeutic communication, which is not necessarily his forte. And so I just wasn't sure, but he was able to find his groove during it. He is a pro at driving everybody around on the golf cart and getting them safely to where they need to be. And I mean, I can't speak for him, but he has come to love the people there too. And they all look forward to seeing him. I got an email from a couple over the weekend, because they are part of my support group and they attend stroke camp, and they said, give Jeff a hug for us. So now, like, he has found his way into stroke camp. And yes, as Mary Lee is commenting, he is pretty good at the skits. He's been featured in the last couple years and does pretty good. And we both have loved it so much that last year there was a stroke camp where they needed extra volunteers. And so we went to Illinois to volunteer, and my husband had been working in South Dakota, and he drove home the whole night before so that we could go to Illinois together to volunteer. And so I just love how Mary Lee and everybody that's associated with stroke camp makes sure that everybody has a place and fits in. I also learned during that first weekend at stroke camp how important that connection is, and that it needs to keep going. One weekend a month, one weekend a year is not enough. And so my first, like I said, I started my job in March of 2017, went to stroke camp May of 2017, talked to people there, and in June of 2017, I had started a support group for the people in my area, because I knew that was something that they needed to keep going, seeing their relationships and how they interacted together, and knowing that waiting a year in between that was not going to work. So we started our support group in June of 2017, and I think I had maybe 6 people that came the first time. We meet every other month, and now I have between 20 and 25 people that come regularly. A lot of my regulars, and they're the people that attend stroke camp, so I am fortunate to get to see those people, some of my favorite people, every other month. But I really try and remember that a support group, like sitting around talking about our feelings, isn't for everybody. So I try to have an activity and then like time for conversation. I really ask them what are things they'd like to learn about. Some of them are really big into gardening, so we had a master gardener come and talk to us. And I just really want my support group to cater to the people that are attending. Everybody looks to me and like I get referred to as the stroke expert, but I don't see myself as the expert. I've never had a stroke. I've never experienced the things that come with it. I look to the people in my support group or my patients as the experts, and so I really look to them to lead me in what are things that could be beneficial for them, or what are things that they want to learn about and do. And again, it's just so great to see how they feed off of each other and give each other suggestions throughout our meetings. We had one of our last meetings before we couldn't have them anymore due to COVID. We had a new gentleman come, and he used to run a lot, and so he's working back up to running. I can't remember if he said a half marathon or a marathon, but just the support from everybody in that room, I'm pretty sure everybody there said they were ready to go watch him run his marathon when he got to that point. Like everybody was ready to everybody was ready to support him on the sidelines and cheer him on. And I just love seeing everybody cheer each other on in those rooms of our support group and at stroke camp. And so I just think that Mary Lee has done a great job with this community, and I feel very grateful to be a part of it. I've learned so much about stroke and people, and just all of the, like I said, just my shifting in my mind frame from thinking like the ICU work was so important. but what is important is what happens outside of the hospital and that support that everybody gets. One question that did come up when I was kind of preparing for this is a lot of people receive their therapies and then, you know, after their amount of time has finished, they are wondering how it's possible to continue to get either speech, PT, or OT, or how they can get those services if they have a change in their functionality. And a big thing to remember is that any change is often a trigger for your insurance. And so if you're having more function or less, you should always reach out to your physician. So just because your 6 weeks of therapy ended, that doesn't mean that you can never receive therapies again for your stroke rehabilitation, as long as you have a change either for the worse or for the better. I would definitely reach out to your physician about getting therapies again. Any questions that you guys have, throw them up in the comments and I can try and answer some. But hopefully that kind of talks about my love for stroke camp a little bit, and the importance of the support group afterwards. I really think that if there is one near you, that you should reach out and participate. And again, it's important to just try and have some of those normal activities. A lot of the people who run support groups that I've interacted with, they do the same thing that I do. They have a lot of the same activities or speakers. We all kind of bounce ideas off of each other. Any questions? Okay, well, if you guys do, you can get them along to Mary Lee, and if she doesn't already know the answer, I can help her. But thanks for letting me talk to you guys. I know that I probably rambled a little bit, but I just really do love this community, and I'm thankful that I had the opportunity to jump on and talk to you tonight. Bye.